Kia ora koutou, Marky here, the grizzled walrus of retroactive jealousy. I wanted to make a quick video for professionals, clinicians, who might come across clients or patients suffering with retroactive jealousy. Now, excuse the background noise here. I woke up full of enthusiasm and inspiration to do this video, so I'm doing it at the first opportunity. So I'm actually parked up in a car park adjacent to a shopping mall, and that's where I am. I'm in a quiet, I say quiet in inverted commas, upper floor, but I think there's a delivery going on, so we may get some background noise, so please bear with me. We'll keep it short anyway. So this is aimed at counsellors, psychotherapists, psychologists, GPs, psychiatrists, social workers, complementary therapists, psychiatric nurses, general nurses, anybody really, life coaches, anybody that works with people, supporting people in a clinical or professional capacity. What do you need to be aware of if you should encounter somebody that comes to you presenting with retroactive jealousy? Now, if you don't know what retroactive jealousy is, see some of my other videos. I'll see if I can put some links below to give you a kind of basic intro to retroactive jealousy. So the first rule of medicine, do no harm. Okay, now you can make retroactive jealousy worse. Okay, so the way you can make it worse is by saying, tell me more about it. The exploration of symptoms. So you might work in a psychodynamic way, but getting somebody, or in a person-centered way, getting somebody to expand upon their symptoms and talk about their symptoms and go into detail about why they feel the way they do, will actually make it worse if it's classic retroactive jealousy. So it's counterintuitive, because normally, when we talk about things and that helps, we explore things, that helps. So remember that this is an obsessive compulsive disorder related ruminatory condition, and talking about the stuff of it, the matter of it, will make it worse. So just think about, I use this analogy a lot, but just think about somebody who has OCD around kitchen hygiene or hygiene in general, hand washing, say. So you wouldn't ask them to expand upon that, or to concentrate on that, or to think about hygiene or germs. You wouldn't talk about the germs, you wouldn't talk about the hygiene, you would talk about the processes. So, and that's where the healing comes in, is in interrupting the processes that maintain the condition. So that's the golden rule, really. When I say golden rule, be careful with the terminology golden rule, because golden rule also means something else in retroactive jealousy, but it's the golden rule for clinicians, not necessarily golden rule for retroactive jealousy sufferers. Now, generally speaking, I'm not a great fan of CBT. I've got qualifications in CBT. That's cognitive behavioural therapy, for those of you who are not aware of it. I think CBT has great things to offer, and I use a lot of CBT, and most of the approaches that I probably use to retroactive jealousy are CBT approaches. I just have some issues around really the philosophy behind how CBT is delivered. Maybe we'll talk about that in another delivery. So for somebody that uses a lot of CBT and is qualified in CBT, I'm not a great fan of CBT, but CBT and therapies that work on on symptoms, so like solution focus would be quite good as well, are preferable. I say the focus on symptoms, the focus on resolution of symptoms are kind of preferable to the kind of person-centered or exploratory approaches. Exploratory stuff can sometimes come a little bit later when somebody's symptomology has been reduced. Okay, there is a place for that, but the analogy that I often use, and I've talked about before, is if you're a physiotherapist or a chiropractor or an osteopath, and somebody comes to you with a joint injury and there's masses of inflammation, you don't try and realign that joint until you deal with the inflammation. You get the inflammation down first, and that's what we need to do with retroactive jealousy. So solutions that break the pattern of rumination are what we're looking at here, not exploration of the thoughts. Apart from a kind of very clinical, kind of targeted exploration of the thoughts in order to challenge them. So we don't kind of get people to expand. We don't get people to we don't try and follow the affect and get people to go into their feelings around this. We work in a very kind of pragmatic, targeted way, solutions, techniques to break the cycle. So one of the things that we offer at retract.com, mini commercial break I guess, is supervision for clinicians. So if you're working with somebody with retroactive jealousy and you want to continue working with, of course we do take referrals from other clinicians, but if it's somebody you want to work with, sometimes it might be somebody that you've worked with on another issue and you want to continue working with them, but retroactive jealousy kind of presents, after a time of working, they say, actually I've got this issue as well. So you want to keep working with them. It's a case where you don't want to refer them on to somebody else, or maybe that would be jarring or interrupt the therapy that you're doing. You've got really good rapport with this client. We do offer supervision and guidance. So that is available by Skype. So wherever you are in the world, if you're a clinician working with somebody with retroactive jealousy, get in touch with us and we can provide some sessions for you. Might just need one session just to point you in the right direction, because mainly it's about avoiding harm, really. So broadly speaking, CBT type approaches don't go into the detail of what's triggering people. Don't encourage people to feel the feelings or dig into the emotional level, because that's going to just reinforce the whole cycle and the whole pattern. Now, if you want to know more about retroactive jealousy, there's tons of videos on this channel and on my Patreon channel. Now you'll see this channel is a real mix of things. It's a smorgasbord of different topics. If you're just interested in the retroactive jealousy stuff, look at the playlists and that will take you straight to all the retroactive jealousy stuff, and you can avoid all the other stuff. If you're a clinician and you're interested in other things as well, there are other things that would be of interest to clinicians on here, and again, look at the playlists and that will take you straight to them, because we cover all kinds of things from the very serious to the quite frivolous, really. So we talk about kind of things like on the serious side, we talk about domestic abuse. We talk about the effects of internet pornography on the brain, all kinds. So there's lots of things for clinicians that clinicians might enjoy on this channel, and there's some things that it may not be your cup of tea or may not float your boat, but it's quite easy to kind of hopefully target the things that you like. So I hope that's helpful. Have a look in the contents box or the description box below. There's a link to the website, and sometimes I put some other useful links to various bits and pieces. If you like what you see, please subscribe, because that helps elevate the profile of the channel, gets the message out to more people. And with retroactive jealousy, we really want to get that message out. So thank you for listening. Rangi Mario.